Well, thank you everybody for coming. I appreciate your attendance here, given the competition. So please, you have an intimate opportunity to ask Dr. Bishop about anything regarding legislation in your state or the Arizona state or any kind of federal level. And let me introduce you to her. Dr. Bishop is a naturopathic physician in private practice and director of a residency program. Keep that in mind. At Keystone Natural Family Medicine in Mesa, Arizona. She is legislative committee chair for the Arizona Naturopathic Medical Association, an Arizona delegate for the American Association of Naturopathic Physicians, and a member of the Healthcare Policy Committee for Congressman Andy Biggs of Arizona. She is sought-out presenter for various community and professional organizations throughout Arizona. She holds a Bachelor's of Science degree from Bowling Green State University in Ohio and earned her medical degree from Southwest College of Naturopathic Medicine. Her professional interests focus on transforming the healthcare system with innovative business models to preserve the doctor-patient relationship and keep primary care affordable for families. She has been awarded Advancing Naturopathic Medicine by SENM in 2016, and she was named Physician Volunteer of the Year by the AZNMA in 2018. Let's give a nice warm welcome to Dr. Kristen Bishop.
All right, hi everybody. What do you guys want to know first? Because I could talk and talk and talk about lots of things, but did anybody come up with like a specific thing that they really wanted to hear about? I just need to update you guys on what we're doing. Okay, so I've been the legislative chair for about 8 years now. I actually started because when I graduated, I was doing a lot of sports physicals because I do primary care, and I mentioned it to one of my colleagues that I was doing sports physicals, and she said, well, you know, we can't. And I said, what do you mean we can't? She goes, the AIA doesn't recognize naturopathic physicians to do sports physicals. So I called my attorney, and yeah, I guess I should tell you also what motivates me is tell me that I can't do something. I'm not motivated by money, I'm not motivated by much else, but if you tell me I can't, then I go like to the nth degree. So I called my attorney said, who's the AIA? I said, I have no idea. And she looked it up and she said, they're just an organization, they can't tell you how to practice medicine. I said, full on them, you know, I'm going to keep going. Well, what happened is I looked at the AIA website and I saw we had a naturopathic physician on the sports medicine committee. And so I called him, his name is Dr. Mark Strong, and I said, why can't we do sports physicals? And he said, because they don't recognize naturopathic physicians. And he said, so I got on this committee to try to help, and I'm the legislative chair. So after about a 2-hour conversation with Dr. Strong, I was somehow the legislative chair. Because he said, you got to come to this meeting. I show up at True Foods in Phoenix, not really knowing anything about AZNMA. I was not at all politically driven. I had never gone to DC Fly. I had never been involved in ENACT. I had no clue about any of this world. And Mark kind of got me in and going, and then he handed it off to me, and then I've been the legislative chair for the past 8 years. So I guess that is being said because anybody can do this. You know, like you guys can all advocate, you can learn it. It's a whole new world when you start into healthcare policy and politics in general, but everybody can do this. So the initiatives this year are pretty big, and we hired a new lobbyist about 2 years ago in September is when Gretchen Jacobs is our new lobbyist, and she's a real go-getter. She had won Women's Lobbyist of the Year multiple times, and she actually kind of found us. She has a special needs daughter and really loved naturopathic medicine, and so she said, whatever it takes, I need to work with you guys. And so we're really fortunate to have her because she is more of a, yeah, let's do it and not worry about it, which is sort of more in line with how I am. I'm more like, let's push this stuff forward. And then we have a great AZNMA board this year, and Dr. Katz is really on that bandwagon as well. So our initiatives are pretty big. We're going to go for an omnibus, which means what we did is we created a task force, and we went through all the Arizona state statutes talk about a boring meeting and a very long drawn out process. We went through every single state statute and anywhere the word physician was used. If we were not included in it, we're going to insert ourselves so that we don't have to keep going for these little onesies, twosies. Because in the past, some of the things we go for were like to sign off on a death record. You know, well, how many of us are even ever going to really do that? But it came up for one of our jobs, so we had to put out legislation for it. And it takes a lot of time and energy and effort. And, you know, it's like one little minor thing. Or, so we decided we're just going to kind of go for it all. So that's one of our major initiatives this year is to do the omnibus. I don't know that we'll get it done this year, but the really, really cool thing and why we wanted to do it this year is our health committee senator is Kate Brophy-McGee, who is really in favor of our medicine. So she's health committee on the Senate side, and then Representative Bartow is on the House side. And they both are big champions for our medicine. So we were like, if we're going to do this, we got to do it while we have them in those seats. So Kate Brophy-McGee actually gave us staff to help draft the language around all of this. So that's in process right now. They're working on the language to get that done. So after that, we'll have lots of stakeholder meetings. I'm sure a lot of people are going to put up, you know, we'll be down there a lot, meeting with different groups that oppose us, but I mean, it's part of the process. So that'll be huge if that happens, because then we won't have to worry. Anything a doctor can do in Arizona will include us, which will be awesome. The other big initiative is a lot of people wanted access. So access is our Medicaid program here in Arizona, for those that aren't from here. And that would have taken a lot of legislation as well. We were access providers about 8 years ago, right before I started, and nobody can really tell me why they closed our code. So we got the code reopened, but the way we had to do it was they only will allow us to see children under 21. So it's the EPSDT program, it's called, which is early prevention and screening something, and developmental, I don't know, it's something like that. But it's for children up to age 21. The problem, Access is okay with opening that up to us, and we already have about 11 doctors who have registered with Access. The issue is now we have to get every single health plan to contract with us. Every single health plan that we've met with has told us that their network adequacy has been fulfilled. My argument is, how can that be when you have 0 naturopathic physicians? But it's a lot of meetings and a lot of, there's going to be a lot of bumps in the road before we get that up and running and going. So part of the problem with that is, like, anyone who signs on to take kids and see children through this access program has to be willing to vaccinate. A lot of the health plans want us to vaccinate in the office. If any of you have looked at the logistics of that, it's crazy. You have to have a special refrigerator, you have to log the temperature at certain times of the day, you have to log all the lot numbers, you have to keep really diligent record keeping, and a lot of our offices just don't have the time or the staff to maintain that. Or there's just a lot to that in general. So that's been a stopping point. All of the doctors who want to take access children will have to have a DEA number. Some of our docs don't. You have to register and credential with CAQH, which you have to have malpractice insurance to do that. Some of our doctors don't. You have to know, obviously, how to do all the childhood screenings and be competent, and I'm really big on that. I don't want doctors signing up that are going to, you know, make us look bad, so we're going to do a lot of training around that and how to do those screenings and what it looks like. The other thing is there can be 0 financial responsibility to the patient. So as you guys know, if a child comes in with, I don't know, something, and we want to give them Ignatia, you know, Access doesn't have that in their formulary, right? So how are we going to get our supplements and things like that to these children without having the parent have to pay? So we're working with Access on that to try to redo their formulary and see what kind of supplements they will pay for. So there is a whole lot with the Access thing. So if you've heard talk about that, we're really only opening it to AZNMA members right now because we want to control that process as we figure all of this out before we just let people join in. Because Oregon did that, and they had a bunch of doctors sign up for their state Medicaid plan, and they did it wrong, and a lot of them were sued, and they got in trouble. So we've worked a lot with Oregon, multiple meetings with them, trying to figure out what they did wrong so that we don't repeat that process. So we're trying to keep that small. And just, I mean, the stopping point right now is getting the health plans to contract us, because if they don't contract us, then we're dead in the water. Questions so far? Yes?
You mentioned like opposing lobbyists. Who are some of those? What are some of
Who
those
opposes
groups?
us? The Medical Association, the Osteopathic Association, the family practitioners usually come down. Those are our big three that always oppose almost everything they want to do.
Do they have like a lot of resources?
Oh. Yeah. Fun fact, the osteopathic physicians and the medical doctors now have the same lobbyist, which to me is a huge conflict of interest. I'm not sure how they manage that, but they use the same lobbyist. So, yeah, as you can imagine, now it's like united, so it's even better, more fun. Other questions? Okay, so what else are we working on? So back to my initial story as to why I became legislative chair and how I got involved in this is we eventually did get sports physicals for kids through the AIA. And if Mark had done about 9 years of work on meeting with the AIA, and it was one medical doctor who really did not want us to have access to kids and athletes. That was stopping the whole thing. So it was really interesting because the day that they said you have to go to this AIA meeting and go, I don't even know what I was supposed to be doing, and I was not happy because I had to get up early in the morning and drive to Phoenix, and I can't stand the AIA anyway, so I was not in a happy mood. I walked in, and I don't know if any of you have gone to an AIA meeting, but they show up all in navy blazers, and I mean, it's like a congressional event, like they have all these tables. So they put me in this holding room, and then they came out, and they said, go sit over here, and then there was this like podium where you had to address the board, and it was a big deal, and I'm like, okay, I'm feeling a little bit intimidated here. So I get up to this podium. Well, first they changed the agenda and said, there's a doctor here who would like to address the board. We're going to move some agenda items. And so they call me up, and I said what I wanted to say, which was basically that we wanted to be able to do sports physicals. And the guy in the back said, you know, you can do that today if you can get someone to make a motion. And I'm like, I don't know any of these people here. I'm all by myself. So the guy over here goes, I'll make the motion. And the guy next to him goes, I'll second the motion. And they approved it. And I'm just standing there, and I look at the guy that said it, and I said, effective when? And he goes, today. And I was like, like I didn't want to say anything, and I was shocked. So I got in the car, and I called our lobbyist, and I go, I think they just did it. And he's like, they did what? And I said, I think we got it. So it was really fortuitous that I was the one standing there, but Mark Strom did all of the legwork on that. So kudos to him, and he's still on that committee for us, which is awesome. So I guess that would be one bit of advice if you guys have opportunities to get on any committees at the state level. I really would like to have a naturopathic doctor on almost every single one. I mean, they have rheumatology groups, they have environmental groups, they have, all of those types of groups. I'm trying to get on the head and spine one right now, and I just heard last week from the governor's office that they were running my fingerprints to get me on that one. That being said, since we got sports physicals, what we want to do now is to be able to clear student athletes from concussions, and we're not currently named as a provider who can do that. So that's another thing that we're going to go for. But as with all things legislative, we got sidetracked on that because physical therapists put some legislation in for a pilot program for 2 years. And so that blocked us from putting in our concussion thing because they're doing this pilot program. So we have to wait for that time before we can go for that. That is another initiative that we have. The other thing that we've been working on is being able to sign medical exemptions for vaccinations. So if a parent brings in a form and says, we want a medical exemption for vaccines for our children, it's typically on the paper, it'll say must be signed by a physician. If you look at the state statute in the back end of the law, we're excluded from that. So we've gone down 2 years to try to get to be able to be named as a medical exemption provider, because if Arizona does what California and some of the other states have done where they take away personal and religious exemptions, then the only thing we have is medical. The MDs come out in full force at that, and they pretty much say that we're anti-vax and that we don't vaccinate children. And so, and to be honest, if you look at this, you guys know there's a state registry that you have to log every vaccine. They do it here at the clinic. It's called ISIS. Anybody hear of that? So we only had, when they pulled that up, we only had about, I think, 3 offices registered with that, and it showed that we did something like 11 vaccines all year. So, you know, that's a hard argument to make when you're standing there. So that's part of that, is what it is, right? Other questions? Yes?
I'm actually from out of state in North Carolina, and working to get.
Yeah, they've been working for 26 years
Yeah.
to get licensed. Yes. Well
Since
aware.
95. So I was wondering what advice you give, because I'd like to get involved. I have done some advocacy and stuff, but I'd like to get more.
Yeah,
Because I'd like to
absolutely.
do it, because they're still working on all the.
Do you know Amy or Maurice or any of
No,
the
I
people
haven't
in
met
North
them.
Carolina? Okay, I can connect you with them, but, yeah, they're doing a lot right now. So definitely, like, if they have a Facebook group or something that you can like, or get in contact with them, they need support bad. So, and students are awesome for that. Are you guys, most of you NMSA members? Okay, because Blake, I don't know who the incoming president is, but Blake was amazing at, like, if Florida needed help, he would send out a message to students from Florida and, you know, kind of mobilize the troops, and it proved to be really, really good for a lot of states. I use Florida because they're going in the wrong direction, and having lots of issues down there. Anybody else from other states that plans to go back and practice there? Which one?
Louisiana.
Louisiana? Okay. I don't know much about Louisiana. What are they doing?
They won't contact me back, so I have no idea.
Who was it, do you know?
It's just their association. They have like an email you can send, but they don't have like a person's name or anything, and they haven't gotten back to me at all.
Okay, I don't know anyone from, I know one doctor practicing there, but I don't know much about their legislation. You staying here?
So I'm in DO school, with the residency, thinking about Ohio or Oregon. But I'm curious about Ohio's legislation for naturopaths.
They have about 22 docs in the program right now, or that are practicing there. And they're trying for legislation, but they're getting blocked. Bad.
Yeah.
Yeah. Look, as an osteopath, you'll have a lot
Oh, yeah.
better time, but, okay. Anybody else? You're going,
I'm thinking about going back to either Utah or Idaho.
okay, which both are licensed. Idaho is one of our newest licensed states.
Do you know much about what's happening in Idaho right now with?
They're doing really good.
Right.
Dr. Joan is kind of leading the charge there. Joan, I can't think of her last name. But yeah, they're doing really, really good. I guess my thing to you guys would be involved somewhere. I don't care if it's Arizona or there or AMP or AZMA, preferably all of the above, just because we're small. And so we have to, you know, I went to an American Academy of Family Physicians conference in Chicago, and I think they had 134,000 members in that. We have about 8,000 nationwide, you know, so we're never ever gonna be able to compete number-wise. That's why, in my opinion, we have to get our patients advocating for us. We have to start to bridge some of those gaps. A lot of the medical doctors and the osteopathic doctors are kind of coming on board. At that conference, they had a whole track about natural medicine. So I think that, you know, they're coming around to it with functional medicine. People are being more open to it, but there's still a lot of opposition, especially legislatively. Some of it makes sense too, because a lot of people will say to me, why can't we take insurance? Well, when I go down there and I say we want to be credentialed with insurance companies, and they say, are you primary care or are you specialist? That causes a whole, I sat in an 8-hour meeting one time in Utah about just that. Are we primary care or are we specialist? We're trained as primary care, but in an insurance world, that means different things. So a lot of our doctors were really pushing hard that we have to go in as specialists, and then there's a whole sect that says, no, we're trained as primary care, we need to be primary care. The other thing that they always say to me is, in order to, if an osteopath or a medical doctor comes in and wants to be a primary care family medicine doc, that's a 3-year residency. Where's your residency? You know, and we can use the argument that you don't make the nurse practitioners do it, and they have a lot less training than you guys do, but it doesn't really fly. You know, they're like, well, you need a residency. So that's why another big passion of mine is to get the residency program up and running, because I think everyone should do a residency.
Are the naturopathic residencies also funded by Medicare? Or
No, that's, okay, so CMS, we'll go back to that, for probably the last, how many people have been to the DC Fly? Nobody? Nobody went? You have? Okay. probably, we didn't do it this year or last year, but probably 5 years before that, we asked to be named as a provider type for CMS, because everybody follows CMS guidelines. So, but they wanted, Congress wanted us to do a, what do you call it? Can't think of the word. CBO to score us. They wanted a score. So that's the Congressional Budget Office. So they wanted to know what kind of cost impact we were going to have. We were trying to say, we're not going to impact it, we're just another provider type. You're already short in primary care. But they wanted CBO to score it. Well, if you paid any attention to Congress, we'll all be dead before CBO comes around to scoring us. So that kind of was dead in the water too. That would have opened a lot of doors. If we would have been a CMS provider named as a CMS provider, they could have funded residencies. It would have opened a lot of doors for like a lot of federal programs. The VA, you know, a lot of those, all those administrations all kind of look to CMS. So that was really disheartening too. So all of our residencies are privately funded
By like institutions themselves,
by
like this one.
me. Like by, no, like mine is funded by me. No. So it's all like just individual. That's why there's so few. The schools all do them, so I think every school funds some. Other questions? What else should I talk about?
Well, we talked about Medicare and the fantasy that if we have 25 or more licensed states, I don't know where that came from.
Yeah, that's not true, but it's still, that's still a rumor going around, that if we get 25, well, then we are kind of grandfathered in, or all of them will go. I think it's gonna take Texas and New York, which neither are doing much right now, so. Yes?
What are some ideas on bringing about more advocacy from the public and one being the veterans as well? To try to, because I mean, that is going to be our only way of pushing is getting more disability.
My opinion on that is to try to get leadership that will just standardize things. It gets really tricky when you go to, you know, when you go to Congress, I'll just be honest, like when I'm sitting there and I'm saying, this is what we want, whatever it is. And they say to me, well, we don't even really know who you guys are. You know, in Ohio, you can't touch a person, you're basically a health coach. But in Arizona, you're giving people morphine. Over here, you're an NMD, over here, you're RMD, here you're an ND. You know, like they're like, how would we do this? So until we kind of get ourselves standardized and make it across the board, I don't think we're going to get too far too fast. But I get pushback every time because I just asked A&P and they did. We now have a task force working on a model bill so that, you know, we no longer have all these weird things. But it's state to state. I mean, look at North Carolina, 26 years and we're still not licensed. You know, what is the problem? So, and I hate to sound negative because the people who are there working are working really, really hard. Like I know the people in North Carolina, but something is off, or we would be a little further ahead.
I mean, like for more of the public, like not so much.
So I&M, the Institute for Natural Medicine, they're, I don't know if you know Griffith, what's her last name? Beth? I'm really bad with names today. They're doing a lot for PR, and they're putting out things that we can all share and do, so that's all helpful. In Arizona, if you want to be an AZNMA, are you guys all AZNMA members, I'm assuming, pretty much? We are doing point people in each district, so once you know your legislative district, we'll kind of have you watch, like Representative Bartow is going to do a fundraiser this Wednesday, so you know we want people from her district to try to attend or let us know, like, hey, this is happening, because there's no way I can keep track of all the things going on across the state and who's doing what. So we're trying to put point people in each district. And then congressionally, you should know who your congressmen are as well. And you guys know there's a difference, right? Like there's the state people and the congressional people. Okay. Took me a long time to understand. Okay. Other questions or comments?
Go ahead. What do you like? What can we do for a state that really that's just not doing anything right now as far as licensure, like Nevada?
Oh yeah, we talked about that.
Yeah.
Do you know anyone there?
Yeah. And I even tried to look up MDs there, and it's like, they're good.
Yeah. It's really interesting. I shared this story when I talked with the Student Veteran Association a couple weeks ago. But some of the states don't want anything to happen. Like,
Right.
I had an issue in Kentucky, and when I called one of the Kentucky docs, and I was like, hey, what are you guys doing for licensure? They were like, oh, we don't want all that, you know, like, we fly under the radar, we got it going on, we're doing our own thing, like, we don't want the time, the energy, we just don't want that. We don't want to have to follow rules. And to me, it's a public safety thing. Like, if we're not licensed, that's a huge public safety issue, because as you guys know, there's naturopaths that can go online and get a naturopath certificate or something, and they do botanicals or, yeah, I don't exactly know what they do. That's very different than a naturopathic physician. So one thing I would encourage all of you to do is always say naturopathic physician. Don't ever say naturopath, because a naturopath to me is the person who did the online lay type of school, which, you know, is fine. They can, you know, I'm not saying it's anything bad, but it's very different than diagnose and treat and prescribe medication and do what we do. So make sure you're always saying naturopathic physician. A lot of the states it's title protected with what you can say. Some states allow you to say doctor, some you can't. Some you can say physician, some you can't. As far as Nevada, I don't know. I don't have any contacts there either. But keep trying, or you're gonna have to start it. Are you gonna practice there?
I'd like to, but I mean, it's a little bit disheartening, you know, there's nothing set up there. But also, like, if they do practice just kind of like under the radar, like West style, if you will, I just wouldn't even know how to like get information
Right.
on that either.
Talk to me. Make an appointment, I've got some connections for you.
Okay.
Yeah, and then get Nevada moving. Other questions? Do you have one, sir?
Yeah, so I know that legislative committees, they use like task forces. Where can students like fit into that? Is there a place for
Yeah,
that?
absolutely, anyone that you want to. So we have the Access Task Force, we have, the omnibus is pretty set. Access is where we need the most help, because it's just a ton of meetings and and trainings, and it's a lot of work, like a ton. What are our other task force? The VA, which I think generally you got connected with Brian Trainer.
Yeah, I need to reach back out to him. I haven't really talked to him in the past couple weeks, so.
I was on a call with him the other day, though,
Yeah.
and he mentioned that you guys had connected, so.
Yeah, good.
That was good. What other ones do we have? Because we're trying to make some headway with the VA as well. And on a national level, we absolutely are. A lot of our docs are starting to work in the VA.
In what states do
Uh,
you see that happening?
Quite a few,
Really?
actually, yeah, more than I had thought, so. Did you get on that task force for the?
No, I haven't yet.
Okay, because that's
I'm,
where.
well, I'm connected with the emails, but
Okay, good.
that's about it.
Okay, good.
Yeah.
Other questions? So yeah, any of the task force students can help out with. Are you guys, is it called Enact still, or is that the group?
I think we just got an email, student-wide email, was that yesterday? That
Yeah.
I think they're starting it back up again.
It's
It
been
seems
kind
like-
of quiet.
Yeah, it's
last
been real
quarter.
quiet.
Okay.
I know since we've been here,
Yeah.
we haven't.
I would say get involved in that
Yeah.
as well and try to like stay connected to what's happening, things like that.
I was just gonna say, January 23rd is the day of the Capitol.
Oh, yeah, perfect.
Mark your calendar. I'll be there.
Do you know anything about what Kansas is trying to do right now?
They are licensed.
They're licensed,
So-
but, I mean, we can't do a ton. I mean, we can't prescribe dispense, of course. We can do acupuncture and we can do vitamin, minerals, that type of thing. But,
I don't know anyone in Kansas either. I mean, I know some of the docs who are practicing, but I don't know any of their state leadership. But honestly, if you guys want to make stuff happen, like, that's how New Mexico went. We had a
Yeah.
few new grads that showed up, and, I mean, they were like powerhouses, man. Like, they came out of nowhere. New Mexico was doing nothing. And then the next thing you know, they're like, we're licensed, and I'm like, wow, like, that was amazing. So, like, a small group, I mean, there was only about 4 of them that worked on it, and they made it happen in record time. So, you guys
how
can
do
do
they do
things.
it?
Just meeting after meeting. They actually had an interesting thing where they got the medical association on their side. So the medical doctors were actually advocating for them. And if you watch, you can YouTube the speech when they got it approved. The medical doctor was the one that stood up and really did the testimony, like, we need to make this happen for the health of our constituents. It was pretty cool. So they kind of went that approach and just teamed up with them and got it through. And Wisconsin is doing a lot. I think they just fundraised over $100,000. Because usually when the states are stuck, it's because it's funding and manpower, you know? Like I talked to a doctor in Indiana, I was on a call with her yesterday, they have 8 doctors in Indiana. And they have the biggest I shouldn't say that, what do you call them? Like naturopathic. Yeah, whatever. They have the largest school in the nation in Indiana, so she said they're outnumbered about 25 to 1 as far as the unlicensed naturopaths to the naturopathic physicians in Indiana. So they need a lot of help there. And Illinois was on a call with me yesterday too, and they're kind of having the same issues. Other questions? Yes?
I'm curious about, once like a state gets kind of a limited licensure in place, how difficult or realistic is it to broaden that scope of practice? And I think it's specifically like acupuncture. To me, it's kind of wild that all these states don't allow acupuncture, even though I think a regular conventional physician can take a really short kind of course and be able to legally needle.
Right.
So yeah, is like broadening the scope of practice realistic, or?
That's where you really have to know your state landscape, because that's what Colorado did. They took that approach, like, let's just get our foot in the door, let's get a license. And then they had to go back and get children under 2, and you know they had some things that they had to battle with, but they had really good relationships in their state legislature, so it wasn't too hard. You know, if you're going to do that and like get a license and then leadership falls off for whatever reason and you go 10 years, then it can be really difficult to go back and get some of those things. So I guess you have to know who your legislators are and what kind of feel you have there, and who your leadership is that can keep driving the bus, you know. But that definitely is one approach, like, and when we battle that within amongst ourselves, because some of the states say, look, I just want to get what we can get and we'll go back later. And some of them are like, no, let's hold out for the whole thing. So right now, that task force, we're trying to define what is the whole thing, like what are we not going to settle for anymore. Because every time you're down there, you're going to make concessions, every single time. Like with our omnibus bill, some of it we left in, we could care less, but we left them in purposely for like a bargaining chip. You know, because if we know we're going to get opposition and they're going to come at us and we're going to say, well, take this. You know, so it's a very interesting strategic little game when you get into this world. But it's fun. Other questions? Does everybody know what Joanna was talking about with Day at the Capitol? Does anybody know stuff? Okay, so it's sort of like our mini DC fly. So we do it at the state capitol, and then we invite as many of our legislators as we can get there, and they come. And this year we're going to do tables. We're going to put the food on the tables, sort of like we do at DC, where people walk around, and that way they'll have a chance to talk to everybody. We're going to talk about opioids, VA, and the school's going to have a table, and I think we decided on mental health for our table topics. Because there's a lot we can do with the whole opioid issue too. So I'm on different task force with that as well, but that's another thing. So yeah, if you want to be involved, like, and you have a passion about something, talk to me and we can try to tie you into that piece. That's sort of what prompted me to do the task force, because there's so much that has to happen, and I understand, like, not everybody cares about treating veterans. You know, that might not be everyone's thing. But for the people that really, really are passionate about that, I want them to be able to serve in that way and not have to feel like, well, why do I have to come to this meeting on opioids when, you know, I deliver babies, or, you know, whatever. So we're trying to kind of segment it out so that people can get involved where they feel most drawn and not be overtasked with, you know, a gazillion things. So.
Is there like a list of all the different task forces?
I don't think there is yet, but if you go to the AZNMA website, I don't know if Darren put it up, there's a member area, and then you go to, I think it's advocacy is the tab or something, and that's where we try to put most of our updated legislative info. I would like to change that so it's a little more accessible, because half the time I can't find it, but you know, and that is one of my goals too, is to let you guys know what we're doing on a state level a little bit more. Did you find it?
Not yet.
Okay. Other questions? Everybody should try to go to DC Fly too. That is my favorite event of the year. You can go.
Do you know when it is for this year?
They're looking at April. We don't have a final date yet, but it's probably going to be in April. It's usually April, May, or June. Last year we did it in June, which was a little bit later than we typically do. I'm pretty sure April. What else can I tell you about?
I have a question.
Sure.
So I assume that with legislation and kind of integration a little bit into like the conventional medicine area, that it's hard to keep like your philosophy when you practice. At least it's happened, you know, with osteopaths. Kind of lost
Absolutely.
everything.
Yeah,
At this point, they're mostly indeed
correct.
minded. You know. So knowing that there's like disadvantages to like becoming a part of the system,
Exactly.
how do you keep your way of practicing your philosophy while also trying to like expand naturopathic
Wow. We struggle with that all the time, even as a profession. We just did it was called the ND Summit. I don't know if any of you guys got on those calls. It started in San Diego at the AMP the year before, and then we did calls throughout the year, and then it ended in Portland this year. From that, we have action teams, but that is one of like the biggest question is how do we maintain who we are and not do what the osteopaths did, and still be able to practice the way we need to practice. So it's a big, big struggle. And in my opinion, our profession is kind of splintering off in ways that are not good. So we have to be a little bit more respectful of, yes, we have our nature cure docs who only want to do, you know, whatever they do. And then we have our, you know, pretty much prescribing, you know, functioning as pretty much a medical doctor or an osteopathic doctor. We have the whole gamut in between. And we just, I think we have to be more respectful of each other and quit splintering off and come together. Internally, it's great to have that eclectic of a practice. It is our strength, in my opinion. But externally, and when we go down to the capital and stuff, we have to do better. Like, we're going to get a lot of opposition from our own profession if we do this access thing, because they're not going to want to vaccinate. So we already know that. A lot of our doctors are like, you know, you're selling out. Why would you want to do that? We don't vaccinate on that schedule. And you know, it is what it is. It's a lot of conversations that we're going to have.
So if you choose to say, okay, I'll vaccinate, do you have to actually stick to the schedule, or can you alter the schedule?
So we don't know. And I shouldn't say this on camera. But our lobbyist almost thinks they gave us this program because we, as I told you, we've been down there for 2 years now trying to get the medical exemption thing. And so she thinks they almost said, give them this because we want to see like, how they're going to behave. Like this to her is a big trial, so the state can say, you know, when the rubber hits the road, are they going to do it or are they not? So I don't know. I don't know how close they're going to watch us. They're going to want us on the CDC schedule for sure. It's a big, huge part of public health.
If we're able to provide medical exemptions, how would that fit in with state?
Well, they're not going to give us that because they think we're going to rubber stamp every single person. You know, they're going to be like, oh, you have food allergies, you know, you have, it's not, there's a defined thing that sets a medical exemption, but it's happening in California left and right, like they're saying, you know, food allergy or whatever, and not vaccinating. So it's going to be interesting. Other questions? I think what else can we talk to you guys about?
Just on the vaccination thing, because that's kind of, I'm not an expert, but how about with it having a schedule, is there any way, because I do know some medical physicians that are about moving to this side of the fence when it comes to vaccinations, is working to create a revision to how that is operated.
Well, there's a huge group in Arizona, and it's mainly driven by the parents to not take our exemptions away, and Nancy Bartow sponsored legislation around that. It was actually interesting how they did it. They had mirrored bills going through the House and the Senate side last year. They all kind of died in session, but it was really fascinating. The parents are driving that, so it's kind of nice we can stay out of the argument. We have to be careful too that we don't, a lot of people came to us saying like, why aren't you in this argument? We know you guys don't agree with the full vaccination schedule, and we had to lay low because if anything came out that would portray us as anti-vaxxers, we'd be dead in the water on so many legislative issues. So we just kind of had to take a neutral stance. I would highly recommend that you don't ever say you're against vaccines. I mean, as a physician, you have a responsibility to, look at public health things, look at what the CDC recommends. The caveat there is the CDC has its thing, and then the ACIP has its thing, and in there it says the physician has autonomy to decide when and when not to vaccinate. So if they ever came at me and said, why aren't you vaccinating? It's not that I don't vaccinate, but if a parent chooses not to, and we educate them and they choose not to, or they do delayed or whatever, then that's what I would use. You have a right as a physician, you have autonomy to make decisions.
I'm just wondering if they're doing any type of, because I did take virology just because I was fascinated. I don't think that there's a go all the way one way, but I think they've gone too far to the left. So I was trying to figure out how can we get that mentality that they've gone almost too far and causing a lot more autoimmune allergy issues.
It's
from
out there.
vaccines.
The Arizona vaccine coalitions and all of those people are making all that happen. And some of the medical doctors and the osteopathic doctors are going down and testifying for sure. Ready to have to go, or what time should we go to?
It's about time. Anybody have any other questions? I see people are leaving for class. Do you mind if students contact you?
No, that's fine.
You want to put your
Email?
contact information on the board? Because I know these guys.
Not very, it's just my name. And then
Dr. Kristen Bishop?
yeah, at Gmail, use that one.
Dr. Kristen with a K?
Kristen, yeah.
Kristen Bishop at gmail.com.
That'll come right to me, not to my office. And I have a few minutes if you guys want any other questions, I'm happy to try to answer. Thanks for coming, that's
Okay.
impressive that you guys are that